again for the last session. And it's about well-being and safety of the healthcare workers, fighting fatigue together and collaborating across Europe. I guess that Mirka, our Secretary General for the European Patient Safety Foundation, will tell us more in her presentation about this campaign that also had a workshop here yesterday with national groups. But I think this topic is really something that has been in the media for a very long time now, even since the pandemic, was kind of over, but the pandemic seems to rise again. So it still is a very important topic to talk about healthcare workers and their working situations, working environment. And we should have had Dr. Nancy Redfern from the UK here, but instead we have the pleasure to listen to Emma Plunkett, who is also working with this joint fatigue group from the UK. So please, Emma.
Thank you very much for the invitation. So this is a little bit of a last-minute change. Nancy had recorded the talk, but the audio wasn't very good. So I'm stepping in to speak live, and but I'm using her slides. So bear with me if it is not as smooth as it might be. And I'm going to take you back, because I've written down a few quotes from the day, to the very first talk we heard, where Professor Natasha said, if we do not support those who deliver care, we cannot guarantee safe care for all. And that's what we're talking about here. And this is, as Dr. Grossman said, this is something that I think we don't want to see, because it's a difficult issue to fix. It will come with, it's complicated, it's expensive, we don't have time. It's easy to say it's someone else's problem and we should do it later. But actually, if we don't do it now, we won't have a healthcare system when we need it, when we grow old and need kind of healthcare. How do I move it on? So this is what we're going to cover. I'm going to start by talking about the impact of fatigue and remind you about the what it does to impact on our care for patients, and also what it does for our own health as healthcare workers. Going to think about some of the causes of fatigue, and you can see what we'll discuss there, and then share with you a little bit about what we've been doing in the UK to try to address this issue. And I should start by saying, so we started our work around fatigue back in 2015 after one of our junior doctors in anaesthesia crashed their car and sadly died on the way driving home, which was really, a moment that gave us a sense of urgency that we need to do something about it. But we still are not there yet. We don't have all of the answers yet, but we are making progress, and that's what this is all about. So just thinking about some definitions, it was always good in healthcare to start with some definitions. So tiredness is heaviness or weariness after work, which is relieved by rest. I think in healthcare we don't just have physical tiredness, we do have that, but we also have kind of mental tiredness. That kind of repetitive decision making that we need to make actually can be exhausting. On the far extreme is exhaustion, where it's gone so far that we can't respond any longer to a kind of emotional or physical stresses. And I think that's where the link between fatigue and burnout comes. Obviously, exhaustion is one of the triad of burnout. So fatigue is in the middle there, and it's really a warning sign that we need to do something differently. It's a reduced state of physiological performance, and it impacts on our ability to do tasks. And it may be that it's caused by lack of sleep, in which case we need to catch up on some sleep. Or it could be that we just need to do something differently, go outside, get some fresh air, some daylight, do some exercise. But it's a sign to us that we should do something differently. And then there's this concept of decision fatigue, and there's a bit of research around this now, where it becomes progressively harder to make decisions the longer it is since you've had a break. And actually what we tend to do is make more conservative decisions. So when I'm in my clinic and I'm reviewing a whole pile of notes at the end of seeing my patients, what I'll do is I'll end up saying that I need to see the patients in person because I can't decide based on the notes, which has real implications for kind of healthcare economy. So these are some of the costs of sleep sleep loss costs for our patients. So after about 12 hours of working, our empathy is reduced. We're unable to pick up on the kind of cues from patients about their emotional status. We've lost our intellectual flexibility, our mood is down, we find it harder to make logical decisions. And actually our analysis of risk will be altered, and we may actually find ourselves taking more risky decisions. We find it much harder to learn. There's a wonderful paper by Matthew Walker called Practice with Sleep Makes Perfect, and actually a lot of data that if you get a good night's sleep, you're much more able to retain kind of both motor skills and kind of knowledge. It has significant impacts for us as healthcare workers, and there's a good review from the BMJ from 2015 which talks about some of the implications of health for night shift workers. So an increased rate of diabetes, perhaps because when we're tired we crave sugar and our diet is poorer when we're working overnight. I certainly consumed several packets of biscuits on the way home after a night shift to stay awake. There are higher rates of high blood pressure and cardiovascular disease, and actually it's been linked with some forms of cancer. Our mood is lower, and we're at more risk of burnout. And importantly, the rate of accident and incident goes up, and actually it's like an exponential increase the longer the shift pattern is. So, as we heard earlier, 6 hours is a great shift length in terms of safety. It just doesn't work for our lifestyles, actually. And people sometimes prefer to work fewer, longer shifts, so they either have more time off at home, or they can do additional work in their time off because of the pressures of kind of social care and kind of the cost of living crisis that I think we're feeling everywhere. So what about the causes then? So first of all, it's worth thinking about on a population basis. We have an ever-increasing elderly population, and as a population, we're having fewer children. So actually, there will be fewer people to contribute to the labour workforce, but an ever-increasing population of older people who need healthcare. We have significant advances in medicine, and I'm not in any way saying this is a bad thing, but the array of treatments that we have available to us and the expectations of how rapidly these need to be delivered put additional pressure on the healthcare workers. So we're expected the whole time to do more with less in many ways. And then we need to think about generational differences. And I've talked with people a little bit about today, and I think our younger colleagues coming through the training system now have very different expectations about what they want from their work-life balance, and understandably so. And I don't think we need to degrade that in any way. We need to accept it. It's perfectly reasonable to ask for decent working conditions. And as on the slide here, you will see that Generation X, which is my generation now, don't feel the same loyalty within their organisations. And certainly we have people kind of leaving the profession at different stages. Generation Y, the younger generation, and they really do want a better work-life balance. They want better working conditions. They want to feel valued. They want to have their physical and psychological needs met in our work. And we are lucky that our work brings us kind of meaning and purpose. But if it doesn't meet those basic physical needs, then we won't feel appreciated by our organisations that support us. Not sure where I'm supposed to be pointing this. We have this relentless pressure in healthcare, and burnout, we know, is an occupational condition, and the most common cause is this chronic excessive workload. But this is compounded by the fact that we've had people leaving the profession. I think this has been exacerbated by the pandemic. And more than ever, we have staff shortages, rota gaps, service gaps, in combination with an increasing patient expectation and an ever-increasing demand on needing to do non-clinical work as well alongside our clinical work, exams, conferences like this to attend, governance, and that puts pressure on both our working conditions at work, but I think also our time outside work, which we increasingly spend doing work-related activities. And There's also a time for kind of entertainment outside work. And I think the people who run Netflix said they were waging war on sleep. I think it's very easy to kind of sacrifice our core sleep at home to gain some other activities. So our working conditions need to be addressed as well, and many people find that they're in poor working environments, and I think we feel sometimes clinically that those who manage our working environment don't really understand the pressures that we're under. It's very difficult to get breaks. Our shift patterns can be very restrictive and not allow us to have time off. And I think there's limited time for kind of civility, joint learning and discussion together with different groups. We also have the attitudes with shift working that actually when you're at work, you're paid to work and you shouldn't be allowed to rest whilst you're on shift. And we've seen this through our survey data in the UK, that our junior doctors, even when there was nothing to do, were woken up by people on shift and told that they weren't allowed to sleep. So in summary, people can get better wages, better work-life balance elsewhere, and healthcare is perceived to be hard work, less well rewarded. And as I said, there are generational differences that mean that actually people are no longer accepting of the poor working conditions. So what can we do? So after the death of Ronnie Patel in the UK, we did a national survey of all trainee anaesthetists to ask for their experiences on commuting, their working conditions, access to rest facilities. And the survey was published in Anaesthesia in 2017. And we found that around 60% of trainee doctors had had an accident or a near miss on driving home, and 84% had found that they were too tired to drive. About 3/4 found that fatigue had impacted on their personal relationships, their family life outside work, and their health. And we set out the Fight Fatigue campaign in the UK to raise awareness of this issue. And we've since gone on to survey consultants, staff grade doctors, and other groups of healthcare professionals have done similar surveys. And our campaign is around these three areas: detection, education, and prevention. So detection to raise awareness of this issue, to raise awareness of the impact of fatigue, and to collect data around it. And some of that is around the surveys that we've performed. It's about educating staff, clinical and non-clinical, about the impacts of fatigue, the effects, as I've described, on healthcare workers and on the patients that they care for, and to think about what we can do to mitigate those risks. If we understand what the causes and consequences of fatigue are, then we will be more likely to change our behaviours. And then we need to think about how we can prevent problems related to fatigue. And we need to have, like every other high-hazard industry has, we need fatigue risk management in healthcare. It's difficult because we can't just stop delivering healthcare. It's a 24/7 business. And when your emergency patient comes in and needs care, we need to be there to give care. But that doesn't mean we can ignore the problem and actually pretend it's not happening. We need to think about what we can do in healthcare to make a difference. As part of our work, we've set standards for organisational responsibilities and individual responsibilities. And whilst the solution to this problem would very much be employing more healthcare staff, that's just not going to happen. So we've thought about what we can do and tried to think about, can we create rest facilities? Can we encourage people to have a nap on a night shift? Can we alter our working so that we're not doing particularly difficult tasks at that time of day or that time of night when we are particularly fatigued, to kind of make our environment as safe as possible? And we're starting to monitor now for adoption of standards. And interestingly, in the UK, the standards that we set are now in our accreditation programme for anaesthetic departments, and they are part of our kind of national audit standards. I don't think it's moving. Can you move the slide for me? Lovely. So these are some of the potential actions that we've been doing in the UK. So we have some resources to encourage people to take a power nap. And we heard about the behavioural insights, didn't we, and the kind of priming and framing. So instead of saying to people going home or on shift, are you okay to carry on? Say, do you need a power nap before you drive home? And it encourages people that actually that is the right thing to do. I think we have achieved a much better culture for acknowledging this as an issue, and that people do discuss this at handover times now in the UK. It's difficult, but I think it's important that people feel able to say when they are tired. Some places are introducing self-rostering to enable people to kind of manage their working pattern in a way that works for them. And in Nancy's institution, they've successfully changed the timing of medication rounds. So your dip at night is between 4 a.m. and 6 a.m. That's when your circadian physiology is particularly risky. So actually, by bringing that medication round a little bit later in the morning, you're less likely to make medication errors. We need to minimise the amount of work that we do during a night shift, postponing routine activities until daytime when there are more people around. And just to be aware of the fact that we are particularly risky at that time, as I said, from 4 to 6 a.m. and ask our colleagues to help and double check. I think our next step is to involve our patients in this perspectives. And Nancy tells a great story about an airline pilot who was awaiting for emergency surgery. And it came to be sort of midnight, and he was like, I don't really want this surgery now. You know, I'm worried that the staff will be fatigued. What do I need to do to avoid the surgery? And the nurse said to him, well, if you eat a sandwich, then they won't be operating. And that's what he did. So ways to kind of think about actually how can we involve patients, not in a way that we want to worry them excessively about their healthcare, but in a kind of productive way to think about how we can work together. And I think that's what we're aiming for and what we've heard throughout today, really, the importance of partnerships. We are all in this together, healthcare, with our patients, with our clinical staff, with our non-clinical colleagues, with those who support us with research. And we need to be working together to find solutions. Yes, education is a big part of this, and Nancy and I have given hundreds of talks around the UK kind of to raise awareness of this and the importance of having rest facilities at work. You'd think that would be easy. There are offices free at night. People are not generally working in their offices overnight, but it's still difficult, actually, and I'm still working on this within my own organisation. It was helped when Nancy's organisation bought these sofas. And so I then went to our organisation and said, look, these sofas have been approved by our infection prevention and control and the fire services in Newcastle Hospital. Please, can we have some as well? And sure enough, we ordered them. So we're putting these in kind of spaces to try and make sure that everyone has access to rest. It's not moving again. Thank you. So this is really to summarise some of the things we've been doing. We've been working on information and facilities. We've been working on organisational culture. Because even if you have the standards, we have lots of guidelines in medicine, don't we, generally? The trick is translating those guidelines into actual practice. There's good data from the Health and Safety Executive in the UK about working limits that we should have access to rest, but it still isn't happening. So actually, the key is how can we develop our organisational culture to encourage these conversations and to make change happen? Next slide, please. Sorry, I don't know what's happening with the clicker. So this is some more information about the standards there that we've set for rest facilities, and we tried to make it so it was achievable for everybody. We would really love it if every member of staff working out of hours had access to a private rest facility overnight. But I don't know what hospitals are like in the rest of Europe, but they're certainly not designed with that as being possible in the UK. And our newly built hospitals barely have any space for kind of staff to even meet together, let alone rest. So what we really need is just a private area with somewhere flat for somebody to lie down where they can be undisturbed to have a nap during their night shift, or somewhere after their shift where they can rest for a period before they get in their car to drive home. Nancy's organisation has put fatigue on their risk register. So this is for staff when they report errors to indicate whether they think fatigue has been a contributory factor to the error being made. And you can see from the pie chart all of the different errors that were made that were felt to be related to fatigue. And we heard about earlier the kind of risk of medication error leading to harm in healthcare. And this has certainly been picked up within her organisation. But unsurprisingly, there are other areas that are affected too. Our ability to communicate when we're fatigued is very difficult. And I often see the doctors in the morning who can barely get their words out because they're so tired. So then it's a real prompt to say, please go and rest before you get in your car to drive home, because actually you can't even have a conversation. Next slide, please. Thank you. So this is what we hope to do with our work. We want to engage people in this issue. It is something that we can do something about. We want to empower people within organisations to make change. It might feel difficult, but you can always do something. And actually, the key is engaging the people who work in the organisation to identify the solutions that will make a difference to them. So actually, we don't like having things imposed on us. We want to be involved in kind of developing our systems. The people who work in the system generally know what is the problem and what they can do to overcome it. So it's about having those conversations with the people that you work with and think about what difference you can make. And to create a network, and it was wonderful yesterday in our workshop to meet teams from Georgia, Croatia, Spain, Austria, to think about how we can work together to spread this campaign. And it's wonderful that the European Patient Safety Foundation are spreading the work, and you'll hear from the wonderful Mirka shortly about it. Next slide, please, thanks. I feel like Chris Whitty. And so through COVID, we had these briefings by the politicians, and they always used to say, next slide, please, during their important presentations, and I've never got to do that before. This was we had a reception, so we've been trying to do some political engagement in this as well. And this was our reception at the Houses of Parliament that we had in March of this year. And this was a wonderful opportunity to get people from different organisations together to come and have a conversation around this. Sometimes it's hard to engage people in senior leadership positions around this, but actually inviting them to the Houses of Parliament was a way to get people interested in it. And we certainly made some more networking connections. And you can see Nancy and Mirka there outside the Houses of Parliament in the UK. Thank you. So sorry, I think that was my next slide. But that was this is a summary of the things that we've done. I've covered this really already, but it's important to recognise the risk. I'll get a double clap now, won't I? To develop a sense of urgency, to talk about it in your organisations, and then to think about what the remedies will be. Some from the academic evidence, but importantly, to look at other industries, to speak to other healthcare professionals, to think about what we can do. As I said, we need to co-design this within teams and to network with others, and then actually think about how we can reward success and, importantly, reward improvement in the area. So those organisations where they've gone from having a difficult culture, no rest facilities available, but they've shown improvement, can we reward them? And then we need to have ongoing measurements of change. Next slide, please. Thank you. I've given up with the pointer. I think we're there. Thank you. I may have a couple of minutes for questions. Thank you.
Maybe that's the picture now is something that we all should do. Just, whoa, to have some exercise also now at the time of the day. So
yes, yeah, quite, yeah.
Participants fatigue is something else, Emma, you have done this for a while, and as we saw at the photos, you had engaged also with politicians in the UK. How have they responded? Do you have a patient safety plan also for healthcare workers that you can work with?
So there is a national patient safety plan, actually, and we have tried to engage with all of the parliaments in the UK. So we've had most success in Scotland, actually, where they've adopted some of the work that we've done into healthcare policy in Scotland. They're interested, but I think they are worried that the solution is expensive, and they don't have the money. So yes, they meet, yes, we have conversations. What we need to see is some change, and that's been much slower from a political perspective.
And other stakeholders, I think about, professional societies and patient organizations, they should be supported you.
So they are much more supportive. So actually we've had many healthcare organisations, the Patients Association in the UK, who've signed up to back the campaign. So they get it and they're willing to share the message. That has been much easier, actually, yes.
Well, that's good to hear. Yes, because we still have some work to do also, both at the European level and at national level. So I will have to let you go because you are traveling back to the UK. Thank you so much, Emma. Now we have the next speaker who is actually coming from here, from the Medical University of Vienna, Niels Bukowski. Very welcome. The floor is yours.
Thank you for having me. My name is Niels Bukowski. I was asked to speak about my personal experience with fatigue from a trainee point of view. So let's see if this works. Yes. So I'm no expert on fatigue from an academic background or something like that. This is purely subjective. I'm a trainee at the Medical University of Vienna at the Department of Anesthesia and Intensive Care Medicine. I'm 30 years old. I have a small child at home. My average working hours are listed here, 55 to 60 per week on average, but that can go up to over 80 in a week. And we work 8 or 25-hour shifts. I just finished a 25-hour shift this morning, so I'm more than prepared to talk about fatigue to you. I have no conflicts of interest, albeit I work at the Medical University, of course, so maybe I have to be careful what I say here and there. I figured instead of just rambling on about my personal opinions, I tried to bring a little bit of structure to my thoughts. And I pulled these factors of fatigue from the webpage of the Fighting Fatigue Together campaign, and just to get a quick glimpse of how they relate to my personal experience. So just to go through those really quick, the first two are about sleep. Of course, repeated sleep deprivation is something that triggers fatigue, and we have to function while being tired, of course. Then there's not being able to express that you're tired. Feeling that things are not going to change. The next one is not being recognized as having a difficult job, not feeling respected or valued, tension between professional and domestic or family demands, and not being able to provide the care in the way that you feel would be appropriate. So let's see how they relate to my personal experience. I've color-coded these, so green is very, very true, yellow is true, but maybe some caveats, and red is not true, at least in my experience. So you can see here that most of these are definitely true for me. Sleep deprivation is very real, and having to function while being tired is something that's just part of the job. I was woken up this morning at 1 o'clock and had to do an acute CT transport from the intensive care unit, and you have to be alert like immediately. You have to be there in 2 minutes, and everything can happen in these critical situations. So that's something that's very tough in the long run. Not being able to express that you're tired, I don't necessarily feel that I'm being muted by the organization or something like that. But the next point here is quite important. I don't think that there's anything I can do about that, so I don't complain, if that makes sense, because it doesn't change anything anyway, you know. I don't feel not recognized as having a difficult job. Everybody's always very respectful when I talk about the working hours and the daily life we experience as trainees. And the respect you receive from various parties in society can vary quite a lot. In my everyday life, I get a lot of respect, but then, of course, the COVID pandemic has shown us that there's also other issues in society with health workers being attacked outside of the hospital and stuff like that, so that's very worrying, of course. And now I can definitely attest that there is tension between family demands, now that I have a small child, and the high working demand, of course, that's just natural to create some tension. Now, last but not least, I think that's also very important, and I will talk about that on the next slide more, not being able to carry out your job in the way you think you should, due to various reasons. Most of them have to do with, time constraints or organizational things like administrative work you have to do, and that is definitely a part of my everyday clinical experience. So the factors of fatigue, I think we check as trainees, at least in anesthesia and intensive care medicine. Most of them are very true in our everyday life. Now, the impact that has on my everyday life outside of the clinic, I just put some here, and I will go through them as well as I can in a structured manner. So we've heard, sleep reduction, that's just something that's natural. Sometimes you get to sleep 4 or 5 hours during a 24-hour shift. Sometimes you don't sleep at all. And then you come home at 8 in the morning and you have to go to work the next day. It's very hard to catch up on that sleep if you do that repeatedly. And that comes with fatigue in everyday life that leads to reduction in exercise that I've noticed for me personally. Because if you continue to exercise a lot and you're sleep deprived, you get sick more often, and then you have to rest again, and it just can become this vicious circle where you have to be constantly alert on how you dose your rest and your exercise in everyday life. Something that's also quite tough, I think, is that I feel that I have to recover after a hard work day. That happens very frequently, so you don't come home after a day of work and you're fresh and you get to meet people or something like that. Sometimes you just crash on the couch and that's it, and the next day you do it again. And that can lead to a feeling of just functioning after a long day of work. Something that's also important to keep in mind that if you have friends and family outside of the medical system, they don't want to hear the stories that we witness every day. They don't want to hear the bad things that can happen to people that we get to see in our everyday life, which is completely understandable, but that can lead to feeling alienated. And in our bubble, we get a lot of support because everybody shares these experiences and you can talk about the cases. But in society, it's quite tough because people want to be happy. They don't want to hear about the bad things, especially after days of work. So that can also lead to your social life decreasing, with you having to rest and just having so much on your mind. All in all, fatigue just becomes natural in everyday life, I found. And this sounds very negative now, but I want to finish my talk with a big but, Fatigue has an impact on everyday life, it has an impact on well-being, it has an impact on your health, but you have to remember that everybody expects 100% of the time, and that includes us. So I don't want to give 80% or 70% or keep something for after work, because when I'm there and caring for a patient, you don't think about this. If I go into surgery, I want to, get 100% care all the time. I don't want people drifting off or taking a nap mid-surgery. And that's something that's, just happening all the time in our work. For anesthesia and intensive care, it's also important to note that continuity of care is quite important. If you induce a patient and you know how the patient reacts to certain medications, to certain surgical stimuli, there's always information loss if you have someone substituting you, even if it's only for half an hour, to just make sure nothing happens and you can eat and then come back. It's always, it's not easy, because you feel it's your responsibility to do the anesthesia, to care for the patient, and it's tough to give that away, even if it means that you don't rest as much. Another thing is you need the workload for training, which doesn't mean you have to work 80-hour weeks or 25 hours at a time, but you certainly need the cumulative hours and the cumulative training. You need to see all the cases, you need to do long procedures just to get a feel for things, and that naturally comes with fatigue. And then there's also the point that fatigue can lead to fulfillment and motivation. There's this psychological, I don't know the correct term, but if you are understimulated and overstimulated, that's bad, but right in the middle there's this sweet spot where you have like the ideal level of stimulation and fatigue, and I think that's also important. Sometimes you get into this flow state at work and it's all, it's very fulfilling, it's a lot of fun, and you maybe just feel the fatigue afterwards, or you don't feel fatigued at all. And then the last point here is that everybody handles fatigue differently. I think fatigue is so inherently woven into the system and into the work we do that there's just not one solution that fits everybody. Everybody has to handle fatigue differently. We all have different personal resources. We all go through different stages in our life that make handling fatigue more difficult or more easier. Yeah, so I hope my thoughts can have some relevance here. I think this question sums it up, at least for me. The big question is how do we manage fatigue in an environment that is inherently fatiguing, where you cannot take fatigue out of the equation. It would be nice to just go to work and feel fresh after the day's work, but that's also part of why we do what we do. That's also very fulfilling. But I think especially in the long run, and I can feel that even after a short while in training, not 10 years, that it has an impact on everyday life. Yeah. So thank you for your time. Thank you for your attention. This is my contact if you have any questions.
Thank you so much, Niels, for giving us direct, input from your reality. Thank you, and we will let the panel step up on the stage. Mirka first, of course. Yeah, it's a bit of moderating fatigue here, I guess. Mirka, of course, because you are telling us about the Fighting Fatigue campaign and what we have heard about now, and so please.
Warm welcome from my side also to all of you at the end of the day, for all those who resisted until the end and managed your fatigue from listening so many times patient safety during the day, which that was the aim. So thank you for being here. And let me tell you a little bit about the campaign that our foundation is coordinating, and that's just for the reasons that have been mentioned. First, the reasons why fatigue impacts, and second, for how, from what we listened to Niels, that it's really present and we can't really get rid of it, but we can maybe find a way how to manage it so that it's so that we are not putting healthcare professionals and also patients in a risk because of the effect of fatigue. So just let me tell you a few words quickly about the Patient Safety Foundation. I think most of you know who we are. We are an independent non-profit organization that is based on a collaborative approach with multi-stakeholder representation. We are working on the themes that you have heard today. So our key working themes have been covered as main sessions of today's conference. And we have our annual patient safety conference that is meant, as again you could see today, to bring our affiliates together, to put them in the reality of one of the hosting country, which has been Austria, with Medical University of Vienna and Patient Safety Network here in Austria, to whom I would like to thank for helping us organizing this event. And we are also part of different campaigns. Well, we are developing our campaigns, but also we try to participate and be supportive to all the other organizations that are very active in patient safety. So we have been listening to Emma about a little bit about UK experience and the impact, and the European Patient Safety Foundation. So we became backers of the campaign already in 2021, and since then we were thinking about how to tackle this problem all over Europe, and we took a bit of time to create our campaign. And decided to call it Fighting Fatigue Together to show that it's a long-term project and that we need everyone to be on board to succeed in it. So Our general objective with the fatigue is to reduce across Europe the negative impacts of healthcare staff fatigue on well-being, on patient safety, and then on the resilience of the whole system. And a few words about how the campaign works, because sometimes we hear about the campaigns being run either on social media or somewhere, but to make it happen with the small resources or with limited resources, you need to think well to be able to succeed. So we know that it's a long-term project, and we know that it's a very difficult topic we want to address. So we divide it into 4 years to start with, and this year is our main focus goes to the healthcare workers. Then we will adapt our communication, and we will, our main focus will be head of departments and hospitals leadership. This doesn't mean that we are not touching all the other parts already now, but we will adapt our communication in as we are working on a campaign. And we have we are addressing it in 3 streams, if you want to. One is we are designing this European campaign that is with the communication tools and with all the support materials and for the national teams. But we are also empowering the national teams, because those are the ones that will make the change in reality. And we also, together, once we have good contacts, we want to, and we have our backers and stakeholders, we carry out collaborative advocacy and to have one message or strong messages that are supported by different types of organizations and stakeholders, leading to a change. And so we designed this, we created a little video. I hope it will work like this. Yes? Oh.
Fatigue is affecting the well-being and safety of health professionals with greater intensity and on a greater scale than ever before. This is leading to unseen levels of burnouts, mental health problems, and people leaving the profession, endangering the continuity and quality of care in Europe. Let's face it, fatigue is only one of the symptoms of a deep crisis. The working conditions have become increasingly difficult. The limits of what is humanely reasonable to expect from health workers have been crossed. And the COVID-19 pandemic has just made things worse. We are all concerned. Research confirms the link between fatigue and patient safety. Health professionals suffering from fatigue are much more likely to be involved in incidents where patient safety is compromised. In some countries, healthcare workers have taken action to make their voices heard. They called for change. They went on strike. They threatened to resign. And yet they don't see any significant improvement. Imagine if we were to join forces. We call on all organizations working with health professionals on a European, national, and local level to start fighting fatigue together. Together, we can raise awareness of the risks of fatigue and its impact on health and performance, taking into account the specific context of each country and finding ways to make everyone feel concerned. Together, we can implement tools and recommendations on how to manage fatigue and improve the well-being and safety of healthcare staff. And together we can strive to go even further. We can advocate for more humane working conditions, allowing caregivers time to rest, time to grow, and time to provide safe care for their patients. Join us in fighting fatigue together.
So that was the call for organizations, and as we designed the campaign, we are still at the very beginning of our journey, but we got already a very nice recognition from European Health Forum Gastein, and we are proud to be winners of this year's European Health Leadership Award. So it was a clear sign from the Gastein Forum and the representatives that it is a problem that we need to tackle, and that the campaign has some legitimacy to address this issue. So how the campaign works again, so we have a European level where we have European and international organizations coordinating the campaign. You might have seen that also from the call, and also from here, Executive Committee, we insist on organizations. We don't want to, or we concentrate on having already structured bodies on board, so that we are not bringing additional fatigue to individual healthcare professionals. So that's the European level, and then we have a national level with national teams that are coordinating their campaigns, because they know their culture, they know the language, they know the politicians, they know the system. So we, from the European level, we can design tools or think about ideal solution, but we need the national teams to implement them and to adapt them so that's into reality. And we are so proud to have there are a few more parts of the systems where we have fatigue coaches that will be leading the change, and ambassadors that are helping us with promoting the campaign on European but also on national level, and of course our dear sponsors who are thinking ahead and seeing how this campaign can improve quality and patient safety and healthcare system. So, and as of with this structure, we are leading change on 3 levels. So one is in the hospitals with the fatigue coaches. Second one is on national level, thanks to the national organizations. And the third one is on the European level, where we want to address this and address the topic to the decision makers. And that's what I wanted to say. I can't wait to say that I'm so proud and so happy to have here the national teams from Spain, Georgia, Croatia, and Austria, who will be helping us, and we will be helping them with addressing the problem of fatigue and its impact on patient safety in their countries. So this is a photo, as Emma already mentioned, so that's from our workshop yesterday, where they were together with us, and we were sharing our experiences, and we were designing and thinking about how we can implement the campaign in these countries. And yes, they're all here, and I'm so happy that they could stay for the conference. So, and the last level where there is this advocacy work, so we are connecting with these European societies on our organization, and we are coordinating the messages. There was one opening that is happening now, where Belgian presidency announced that they are putting healthcare worker crisis on EU agenda, and we could participate in the stakeholder consultation, where it has been announced and confirmed that healthcare workforce will be one of the priorities for the next presidency of Belgian presidency, where they want to support healthcare, national health workforce strategies, and we can see their working conditions and retention, so will be one of the topics they want to address, and they want to, the presidency has the kind of mandate to ask Commission to develop projects or legislation or work on this improvement. So we are very happy that it is there, but again, it just shows us that it's the very beginning, and we need to together continue with this work, and we will need all your support. And so please join us, and with your resources, with your networks, everything that can be brought into the campaign is warmly welcome. So let's start fighting fatigue together. Thank you very much.
Yeah, thank you so much, Mirka. And now the panel. And the panel is asked to have a response to what you have heard. So no own presentations, but to really have listened and to react to what you have heard. Well, I can offer to react on what you have heard all day, if you like, but especially at this last session, because that's the most important part you have now as a panel. And I would just like to introduce, because some of these people are not the one that you see in the program, but it's the same as you see at the pictures, though. So we have, let's see if I can pronounce your name right. Mikna?
Let's see. It's Mishnaks.
Mishnaks. Ah, that's difficult. Christian, I recommend then, I will say, because for my own sake, because I have to warn you, I have been speaking in several conferences all week, so I'm stumbling right now at all names from all countries, so I do apologize. Let's see if I can do the next one. Dora Karmelic from Croatia, and we also have Pedro Vieira dos Santos from Portugal, and also Panagiota Tsikala from Austria. Almost. Yeah, but you live here.
I'm a nurse here, so...
Yeah, that's good enough. Yeah, this is really a challenge to have the last words, you know, at the conference, because that's really what people would remember, maybe. So I leave the responsibility to you for the whole day now. Don't feel any pressure at all. But to start what we have heard in this last session, the impact of fatigue and what Niels was telling about from the reality, the campaign that Mirka spoke about, and also that we heard from Emma. Fatigue is something that, I mean, it's not only in the healthcare sector. You can feel it in and have the problem in different industries, of course, or working environment. From your point of view, Dora, how do you think that this is especially important in healthcare?
Well, I would say all professions carry their own responsibility. Person who drives bus is responsible for maybe 40 people inside, the pilot of the airplane for hundreds. We are responsible for a single life that is in front of us. But we are also responsible for ourselves. And mistakes are kind of, people expect that there would be mistakes in the production process. People expect there should be no mistakes in healthcare, but of course they will happen inevitably. And fatigue is recognized as one of the reasons leading to it. And it needs to be recognized and mitigated. And I'm very happy to be participating in the Fighting Fatigue Together campaign from side of Croatia, because this is a country where maybe safety culture is not as advanced in some other countries. I have heard from my seniors that we are paid to work, not to rest. And it may sound tragic or funny, but and I have had colleagues who have committed suicide because they were not recognized as perhaps fatigued or someone who needed support and recognition early on. I have, as I'm sure many of you, had a near miss in a car after a tough shift, and there is no systematic response to fatigue in healthcare workers in Croatia. Some research from my country on burnout suggests that 1 in 5 nurses in critical care is suffering from extreme burnout. And that was pre-COVID data. So I'm very happy because patient safety is such a huge topic. It's easy to get overwhelmed with all that we heard here and changes that need to be done on so many different levels. But this fighting fatigue campaign addresses one very real, very serious concern with very actionable steps. And that gives me hope that we will be able to introduce change in a very real and meaningful manner.
Thank you so much. I would like to ask Pedro and Christian the same question. You are representatives from the life science industry, the medtech industry. How come that you are supporting this campaign and this work with patient safety as you do? Because you are long-term partners also to the European Patient Safety Foundation. But for the audience to know, what kind of interest do you have in this patient safety area? How come it's so important for you? Should we start with Pedro?
Sure. Is it working now? Yep. Okay, good. Thank you, Pernilla. I would say that the main reason is the patient safety side of the campaign, right? So the impact that the fatigue has on the patient safety is the number one, and as you mentioned, our relationship with the foundation is really based on that focus on the patient safety. I would add two other parts. Is that we work with healthcare professionals every single day, and our teams actually have long-standing relationships with healthcare professionals. So we have seen throughout the years what fatigue can do also impacting those healthcare professionals. And unfortunately, we also see some really nasty impacts on those. And the third one, which is a big one, is we are in the middle of a huge healthcare crisis because for many reasons, and fatigue in the broad sense of it is having a huge impact on just people leaving the profession. So we are not in the position of guaranteeing good healthcare for the coming years if things don't change. So I think those 3 points are the reasons why we have been involved into this campaign.
Thank you, Pedro. And Christian, your point of view.
Yeah, thank you. So as industries in healthcare, we have basically two possibilities to support patient safety. One of our possibilities is a pretty direct way to bring technologies into hospitals that can get used from healthcare workers to provide the best possible treatment to patients that comes to hospital and are sick. And an indirect way is to support the healthcare workers in doing this job. And just for Edward speaking, our first and foremost priority is the patient as itself, and then the healthcare workers comes directly afterwards. And when we can support with our effort to lowering the burden for healthcare workers, then that is extremely important for us, because then we can increase the likelihood that patient safety is getting better. And we see it the same way, like Pedro described it for Medtronic in this case. We're facing for a massive healthcare workers crisis and healthcare providers crisis, from financial perspectives, from infrastructure perspectives, but also from professional perspective, because we need more healthcare workers for the societies as we have more patients in the future. And when we can support those critical symptoms like fatigue in healthcare workers, then this is a very important responsibility also for industries to care about this. So that's how we see it.
Thank you so much. And this round, I will end with Panagiota, because you're a nurse, and your reaction or your response to what you have heard during this conference.
Should I be Greek or Austrian? The way I will speak, I mean. because personally, I'm a very honest person, and I would like to speak as a frontline healthcare professional, as one of the bottom, as the dear friend there said. And I would like to talk about us nurses. And I would like to talk about a book that you probably know. It is named All Quiet in the Western Front, im Westen nichts Neues. So I believe that I and my colleagues are the soldier who dies at the last page of the book. I'm not talking about the movie. The book from Erich Maria Remarque is my favorite one. And I believe that I am the last soldier that at the end he dies, and what the report says, nichts Neues, nothing happened. So we are sometimes forgotten. We are the biggest part in the healthcare system, in a system that I don't actually know why we're put in that position.
You miss the nurses here today.
I talk about the nurses. I am very, very proud to be a nurse. My children are very proud that I am a nurse and not just a nurse. And I am here today because I love my patients. They are like my children. I want to protect them. But you know, it's not cooking food. Every patient, every individual is different. And you need to give to everybody something special, something a bit different, like to be a fellow traveler. And this takes a lot of effort, believe me. And I would like to say that for me it's a vision. I would like to give something. I feel blessed that I'm a part of the healthcare system, even if we're a bit forgotten, and that I could give a little small, a very, very small impact, that my children, when I will not be here, they will say, you see our mother, she did this little thing. I believe in humanity, and I think this is our legacy. We owe that to our children. And when I say our children, I don't talk only about my biological children. I consider all the children on the planet, that they will be one day healthcare professionals, patients, all these things. I think we have to do something from our heart. And I'm here representing, yes, Austria. And I would like to thank Austria, because I'm only 4 years here in this country. It's not very easy. I am from Greece. I have been in Cyprus. I worked in Ireland. Now I'm here. The problems that the nurses have, it's everywhere the same. If Greece is, let's say, a poor country, Austria is not, but our problems are the same. And personally, I am a second victim. I did a mistake once. And I immediately said, of course, the mistake. After, okay, the patient was fine. But this was like, I don't know, 15 years ago, and I still remember that. Almost every day I'm thinking, you know, sometimes it comes to my mind. And I'm always saying, okay, let's check again. I mean, it's a bit hard. And we need not the soft skills, we need the hard skills. These soft skills are really hard, actually. They're not very, very soft. I think.
Yeah. Okay, thank you so much. Yeah. We don't have any patient representative here in this panel, except the fact that we are all patients sometime. Of course, yeah. We are patients for a longer or shorter periods of life sometimes. And in other conferences, I'm also playing the role of a patient advocate. Because I'm also working in other areas within healthcare. And if I should put on that hat now in the end, I could say that we could have several witnesses also from patients that says that I have not felt seen, heard, listened to when I have tried to say something about my own condition, what I think to the doctor, or a lot of things going on. So I would like to transit also to something that concerns, not only the healthcare workers in the setting that of course, there is a difficulty to see also that we lack healthcare workers. That's a fact. And that will, of course, create more difficulties also for the patients. But I think we need to also step into the field of the patient's eye about patient safety to see that it's not that fun to really come to a healthcare facility and to see that this healthcare worker is not properly trained, tired, rude. There are a number of things also to think about from a patient side. Should we just say that the patient do not have any responsibility? Of course they have, yeah. So it's also a common relationship that we should create. But I think also the next conference we will have about patient safety will also try to have also the other perspective. Because if you meet a lot of patient organizations, they have a lot to say also in this matter. And this patient safety is something about patients' rights, isn't it also? That you have the right to be treated safe and secure in healthcare. So I will just round up this panel by asking you the same question. And the last one have a lot of seconds to think. And the first one is have to think very fast. But if you should have something that have been, most memorable during this conference, and to recommend also for next year, what should that be? Starting with Christian.
Thank you, Pernilla. So the remarkable things from this conference are basically two things for myself. So from an organizational perspective, to support healthcare workers specifically when it's about fighting fatigue or to fight against fatigue is a question of decision. It's an organizational decision. And when health care provider systems like hospital chains or private hospitals, if those are single ones, it's a decision that they made for their healthcare workers. And when organizations decide that they don't care about healthcare workers' fatigue, then nobody is talking about this. And then the problem is getting more and more intense. So, and that's much more addressed to the leaders in hospitals. It's your decision how you treat your workers, and that affects the treatment of patients. So that is one aspect. The other one is that a simple sentence, what we see is what we get. So when I am a patient, and I was a patient in summer, going to University Hospital in Hamburg, and what I see when I go in hospitals as an industry representative is what I may get when I'm a patient, and that was exactly the reality. So seeing fatigued people, nurses, physicians, seeing the demands that sits on the organization, the limited capabilities that they have to give treatment to patients, a full-packed ED department, and so that is what you get as a patient. And honestly speaking, this is not what I want when I'm sick. And that's why we are so intense in Edwards to support this campaign, because all my colleagues, and of course my relatives, my friends as well, don't want that. And that is why we are doing this.
Thank you. Dora.
I have seen some very interesting technological solutions here, and some were mentioned and some are just developing yet. And I'm very excited to see where it takes us and how it helps us to give more time and more care to our patients while being safer altogether. So I'm excited to hear in the next conferences more about new solutions, but that do not add to our time on the monitor, but that add quality time with patients while being critically evaluated for their safety impact. Thank you.
Thank you so much. Panagiota, yeah, what are your wishes for the next year?
For the next year, I believe that we should have, let's say, a patient sitting here, or we could even share our experiences as patients. I would say that I wouldn't want to be a patient in the hospitals where I worked until now, and I don't feel very proud of this sentence, but when I was a patient, well, my experience was not the best. And I don't want this for my patients, because as I said, I'm very protective. When I have a patient, this patient is protected by me. I'm there 100% for my patient, and my patient knows that. I make it very clear. And when the patient feels safe, I can say that the 50% of the job is done. It is very, very important. This is what I have to say.
And the last word, Pedro.
My God, no. Well, first of all, I just want to say that as a board member of the foundation and as a sponsor, I couldn't be more happy and proud of what happened today. So that's the first thing. Because I heard so many good presentations and really covering so many different aspects of what patient safety is. And it's not just one thing, it's many things. What I would like to see next year, apart from all of you and a lot more, is there is one thing that grabbed my attention even more than the other, which is the patient safety checklist. So no pressure on our Norwegian colleagues and friends, but I really would like next year to know more about how it's going and how the trial results came, because the empowerment of the patient needs to start in some way, and I truly believe that the Norwegian experience can be a great way. This doesn't mean that I didn't enjoy all the other presentations, which are very important, but that's one that I would like to see next year as well.
Thank you so much, and thank you to the panel. Brigitte and Michael, where are you? How do you feel after this day so far?
For me, it was a very interesting day, a long day, with lots of information, new information. Also, I take for the platform the idea with the patient safety talking from Norway, and I thank you very much for joining us here in this wonderful hall. And I think it's the end of the day, and you have the chance to take further networking at the Josephinum. Thank you.
Thank you so much for your collaboration and organizing this. We are very grateful from the foundation. And Michael, how you have been one of the speakers, but have you discovered something that you haven't heard, or especially to mention?
Well, there's a lot of things, so thanks to all of you, to the speakers and also to the participants of this conference. We had a very good discussions also in the breaks, and I'm very excited to have more discussions later on at the get-together meeting. I'm very excited, I'm very inspired by so many things I heard today. For me, it's very interesting because usually I'm at neonatal or pediatric conferences and there's not a lot of discussion about patient safety there usually. So some of our colleagues internationally try to put some training and patient safety things in there, but it's always difficult, and it was so exciting today to hear from so many different perspectives. I don't have one specific topic where I say this was like the best, because everything was extremely interesting. I'm looking forward very much to next year. I hope we can continue this even more with more in-depth discussions about several topics. And yeah, I hope that I see some of you or most of you later on, that we can have more discussions, more collaboration ideas, more project ideas. And to the rest, I wish you a very nice evening and a safe trip home.
Thank you once again for attending, and have a good trip home. Thank you.